In order to prevent pneumonia, we use breathing and coughing exercises, an incentive spirometer, splinting, and pain management. In order to do breathing exercises, you need to sit up straight. You want to breathe in through your nose and out through your mouth with pursed lips. So an example would be whenever you're breathing in, you want to make sure that you're expanding here, and whenever you're breathing out, you'll kind of feel yourself kind of go in. Again, it's very important to make sure that you're sitting up straight. The next exercise that's very important after a post-abdominal surgery to prevent pneumonia is splinting. So you would put a pillow on your stomach wherever your incision is and kind of hold it firmly. And then what you're going to do is you're going to breathe in deep, just like you did for your breathing exercise, and cough twice. You want to do that again, so it's very important to have the pillow there because it's kind of keeping your incision safe and it's also preventing pain. You want to do both your breathing exercises as well as your splinting with the coughing 3 to 5 times a day, or 3 to 5 times an hour while you're awake during the day. Another good breathing exercise would be breathing in and holding that breath for 3 seconds and releasing. So you want to breathe in through your nose. Again. Again, 3 to 5 times an hour while you're awake. These are all really good exercises to prevent pneumonia after a post-abdominal surgery. So the next thing that we're going to talk about is an incentive spirometer. This is a device that's used in a lot of hospitals after post-abdominal surgeries. So it will come in, it'll be like a little box thing with a tube. You put that little tube in your mouth, and you want to make sure that your mouth seals that tube. Inside of the box, there will be like a column that has numbers, and it has a piston inside of it. It's just like a blue disc. And the goal is you're going to breathe in just like you would through your mouth, not through your nose, through your mouth. And you want to try to keep that piston between the two arrows and get that piston to go as high as you can, and then breathe out very slowly. So what you're going to do is make sure that your lips are sealed on the thing. And like I said, with the piston, you want to try to get it up as high as you can, but keeping it between the two arrows. If the disc is not staying between the two arrows, that means you're either breathing too fast or too slow. The last thing that I want to talk about is pain management with post-abdominal surgeries to prevent pneumonia. So with post-abdominal surgeries, of course, you're in a lot of pain. So you typically have some type of pain med that's PRN or as needed. And you want to just kind of make sure that you're keeping up with those as you have pain. You don't want to make yourself reliant on them, so you don't want to exactly, get them at a certain time. You want to make sure that you do it whenever you're actually in pain.